Yeah. So moving further, we have our next topic, that is epidemiology. Epidemiology. Okay. So under epidemiology, we have two terms. One, we have descriptive epidemiology, descriptive, and we have analytical epidemiology. Okay. Descriptive epidemiology mainly deals with the formation of hypothesis. Formation of hypothesis. Whereas analytical study deals with the this testing of hypothesis. So formation is undergoing under the descriptive, whereas testing of that hypothesis is analytical. Okay. Under the analytical, we have four varieties. One is case control study. Another is cohort study. Then we have ecological study, and then we have cross-sectional study. Okay. So this case control deals with these two deals with individual. This questions came into the UPPSC 2022. This one they had asked about the ecological one. Cross sectional also deals with the individual, but ecological deals with the entire population. Okay. Now moving further, just a few words. Okay, we will study in next only. Yeah. Moving further, we need to understand the difference between case control study and cohort study. Okay. What is the difference between case control and cohort? See, in case control, we are going from effect to cause. Okay? Effect to cause means what we are doing, we are going retrospectively. Okay, suppose a patient comes to you, he is having sore throat. Okay, so a person comes to you, he is having sore throat. Okay, so first what would have happened? Some streptococcal throat, some streptococcal infection he or she would have been suffered from. Okay, and then when he or she came to you in the clinic, that time he or she was suffering from that one, from sore throat, so that, or pain in the throat, so that pain in the throat. Okay, so that suppose take an example of sore throat. Okay, so patient comes to you with the pain, or maybe difficulty in swallowing. Okay, whatever it was. So this, what is this? This is the effect. Okay. Then what is the cause of this pain or difficult in swelling or etc.? The cause could be so some streptococcal infection. Okay. So what we are doing, we are going from effect to cause. Here we are going from effect to cause. It means we are going retrospectively. We are going back, and we are observing what had happened, or what had caused that thing. Okay. So case control study is, if we are going from effect to cause, or we can call it as retrospective study and observational study also. Observational study. Okay. Whereas in cohort simply we are going from cause to effect. Means ठीक. Here we are going from effect to cause, and here we are going from cause to effect in cohort study. Okay, cause to effect. So basically we are going in a forward direction, prospective study. Okay, now next thing is, next point we have, yeah, first point, second, case control study is mainly done for rare diseases. Okay, whereas cohort study is done for common diseases. ठीक है. Then for rare disease we required less time, common disease we required more time, because common disease more will be the sample size, more time it will take. Okay, so it will take less time, less study time we can say. Whereas cohort study, there will be prolonged study time. Then of course, when we had told that case control is for rare disease, it means less number of people will be affected. Rare will affect rarely only, no? So there will be sample size or subject will be very small number. Okay, so a small number of subjects, and common disease will affect most of the people, so large number of subject, large number of subject. Okay, next. Case control and cohort. Yeah. Then we have, when we have less number of people, so whenever the things are very less, chances of bias are more. Chances of biasness are more. Okay. And whenever the sample size is more, chances of biasness is very less. Less bias chance. Okay. Then case control study, see, we have small number of subject, we have small study time, so it is quite less expensive. Sorry, expensive. Whereas cohort study is highly expensive study. It takes lot of financial support. Then the most important point, that case control, it yields odds ratio. It yields odds ratio, whereas cohort study yields what we can say it as a cohort study yields that relative risk, incidence rate, or we can say it as attributable risk also. Attributable risk. Okay. So among the case control deals with the odds ratio. See, uh, case control deals with rare disease. Okay, and rares are always, we used to say na, if someone is very, we used to say that that is the something which is very peculiar, we call it as odd. Or we suppose someone is doing some strange things or strange actions, so we used to say that 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 is the thing which is making him odd one out. Okay, so odd is the rarest thing which most of the people is not doing. So case control deals with the rare study, and rare are odds. Okay, rares are not common, so rare occurs rarely, and that is odds. So case control deals with the odds ratio, whereas cohort study deals with the relative risk, attributable risk, or this one, incidence rates. Okay, so this is the difference between the case control and the cohort study, and most important for the exam. And Among this point is very, very important. Okay. Next, we have a nested case control study. Okay, we will take the another nested nested case control study. What is nested case control study? It is a case control study, or it is a case control study within a cohort study. Okay, within a cohort study. Okay. Why it is done? It is done to eliminate recall bias. Okay. To eliminate recall bias, selection bias, etc. Okay. So recall bias, basically recall bias is this case control study is suitable for recall bias and selection bias. Why? Because see, you are going to study about some disease which is very rare. Okay, and you have to go retrospectively, you have to go into the back and you have to search who all are suffered. Okay, there, just to complete the study or because of some other reason, there may be a biasness comes under you to in recalling. Okay, because of the less number of people, and biasness, there will be more chance of biasness in selecting the subjects also. Okay, when more people are there, when we have more options, then we can easy, when we have a lot of options to select. But when we have less number of options, then we have to select, then we can go for the selection bias also, selection bias most mainly. Okay, so case control study concerns with the recall bias and selection bias also. Okay, so this was about the case control cohort and nested case control study. Why we are doing nested case control study? To eliminate recall and selection bias. Okay, next we have evidence pyramid research. Evidence pyramid in research. It is like food pyramid we used to say, na? So this is the evidence pyramid in research. See, we have different types of studies. We have in vitro study. We used to do study on animals. Then we used to do the case reports. Suppose you had treated a very good case, so and you want to publish it, a single case. So that is the case report. Or if you had suppose someone had treated 10 to 30 or lot of watts cases, and now he or she wants to publish those cases, so they will compile all the cases and then they will publish. That is called case series. Then we have case control study, we have cohort study, then we have systematic review, then randomized control trials, then meta analysis, etc. Okay. So what we need to remember here for the exam, we are not going to in detail for everything. What do you need to remember that, and this is from top to bottom. I am saying top to bottom means from above we are going down. Okay. And at the top, what is this? At the top, meta-analysis is there. At the top, meta-analysis stands, whereas at the lowest in the pyramid, we have in vitro study, in vitro research, okay, or in vitro or test tube research. This is having less clinical relevance, okay. And this meta-analysis is also known as it is having highest clinical relevance, highest clinical relevance, and therefore this is gold standard, considered to be gold standard, okay. Then we have RCT also, randomized control trial, and etc. In randomized control trial, basically we used to do for minimizing the bias. we used to randomly select the people population to whom basically what used to happen in we used to do randomization. The randomization we can do by some softwares are there, or by the computer generated softwares. There you will get the standard chart or randomization chart, in where it will be like this. Suppose you have 10, sample size of 10. Okay, so you will get like this. Here, suppose 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and you will get the chart like 1, you will get P, 2, P, 3, HI, 4, P5HS. So basically, it is randomly, means for one patient you will go plus for placebo. Second, the second number, the patient who is coming second to you, means second number of patient you will go for placebo. Third number you will give HI, means individualized homeopathic medicine, like this. ठीक है, it is about RCT. It could be single blind. Single blind means one patient does not know what he is getting. Okay. Then it could be double blind, where doctor and patient, doctor as well as patient both doesn't know what they are getting. Doctor does not know whether he is giving placebo to the patient or medicine to the patient, and patient also does not know. Okay. And some studies are triple blind also. Okay. So this is we are not going into the detail of it. Okay. So, and RCT is considered to be gold standard for testing therapies. Okay. So, in okay, this is about the evidence pyramid. Next, we have type of bias, types of bias in research. So here we are going to study only the important one, not every type of research. So the few biasness which they used to ask you repeatedly in the exam. So first we call it as this Bergsonian bias. Bergsonian bias. Then we have Neyman bias. Neyman bias. Then we have Hawthorne effect. Then we have silver glaze bias. Other bias are also there, but that you will get by the name only. Okay, if you will. So Bergsonian bias is basically it is the bias which arise because of the different rate of admission to hospital. Okay, different peoples are admitting for the different diseases in hospital. So because of that, if some bias is arising, that is called as Bergsonian bias. Okay. Then we have Neyman bias. What is Neyman bias? Neyman bias the bias due to missing of fatal cases, or due to missing of fatal cases, or mild or silent cases. Basically due to missing of the cases. Okay. Because of that, suppose see you had treated 100 people, and if you will lost the file of 30 people or 20 patient, then that those file got lost. Now what you will do to complete the study, you have to manipulate those cases. Okay, or you will in either way, either you will make the new patient, or means you will do something to get sort of that problem. So because of that, some that biasness occurs. That biasness is known as Neyman bias. Okay. Then comes the Hawthorne effect. What is Hawthorne effect? Hawthorne effect is simply nothing but the attention bias. Okay. So just remember that Hawthorne effect is the attention bias. What is attention bias? Simply when you are treating the you might have observed now, when a doctor used to ask the patient, so just to get attention, they used to change their behavior, or they used to change their statement and all. So that is causing the biasness in selecting medicine or something else. Okay, so that is called the Hawthorne effect. Then we have silver blaze bias. See, silver blaze is somewhat like the name of a company, pharma company. Okay, so silver blaze is the bias by pharma company. Okay, when they only show the studies which is depicting the positive results. Suppose a new drug had came like this. Suppose a new drug, Disprin, had came into the market, and for headache. So new studies will get published. Okay, and depicting the role of Disprin in headache, positive role in headache. Okay, and they will omit the negative results. That is called the pharma companies. Okay, this is mostly some people might not what I can say might not mhm, might not agree with me, but uh, this positive result studies mainly you just see the studies in homeopathy. In homeopathy, most of the studies showing the positive result. Okay, this is not possible, na? That every study what we are doing showing positive, most of the studies showing positive results. Okay, so this is silver plus bias is the done by the pharma companies which promote the positive result studies and omit the negative results. Okay, this is about the biasness.